last in the series of webinars on wellness centers and peer-driven programs. We have Ann McRae, as usual, and also Adrienne Hilton, who is talking to us from Alaska, actually. But she's going to be giving us some information about workforce stuff. So as before, if you haven't participated in these before, there are two ways for you to ask questions or to comment. One is to type your question in the question box that you'll see on your dashboard, and the second one is to click on the hand icon next to your name, which alerts me that you've raised your hand. We'll be stopping for questions along the way, so I'm going to try to monitor the questions and comments and give everyone their turn when necessary. So with that, I'm going to turn it to Ann.
Hi, welcome back, everyone. Or for those of you who are on your first webinar, welcome. I'm very pleased that Adrienne Shelton from the California Institute of Mental Health has agreed to give us an update on the funding. I know Adrienne was working on this to the very last minute, including the budget updates that just came out on Monday. So you were getting this really hot off the press. I also am very appreciative of her taking the time out of a conference she's attending in Alaska to do this. So you will notice that Adrienne has, on the slides, has a lot of information. So instead of having frequent breaks for questions, I'm going to ask you to hold your questions for Adrienne until she finishes her part, because I think some of the things that you'll ask she will have answered in the next slide. So without further ado, I'm going to turn this over to Adrienne Shelton, and then I will be doing the second part on supplemental fundings and outcomes. So Adrienne.
Good morning, everyone. Thank you for having me on this call. Can you hear me?
Yep.
We can hear you.
Okay.
And so I have your first slide up, the estimated community mental health services.
Great. So the purpose of this presentation really is to review some of the nuts and bolts of community mental health funding streams in California, as well as some of the pretty major policy changes that are taking place up at the state level, which are impacting both the mental health programs themselves as well as the funding. So on this first slide here with this pie chart, this is a picture of the funding streams that comprise community mental health programs in California. And these are estimates actually prepared by the California Mental Health Director's fiscal consultant, Geis, who some of you might know, of the funding streams and dollar amounts beginning in fiscal year 12-13, which is just around the corner. So I'm going to be reviewing some background information about these sources later on in the presentation. But just really quickly, we have, so the funding sources include our 1991 and 2011 realignment funding. We have, of course, the Mental Health Services Act, and we have federal financial participation, which is our state's match for our Medi-Cal program. And so that amount, as you can see from that pie chart, represents our largest revenue source for county mental health programs. So we really have no state general fund reliance for our community mental health system anymore. So going on to the next slide here on Realignment, 1991. So like I said, I wanted to take you briefly through each of these funding sources because it's something you might hear a lot locally from in your counties. So the 1991 realignment, this refers to the realigning of both the funding and the responsibility for mental health services, social services, and public health services. And I've underscored this in the PowerPoint, but this funding stream, when it was enacted back in 1991, really represented a major shift of authority from the state to the counties for mental health programs. So just a little bit of background kind of leading up to this shift. The state allocations to counties for mental health were really severely reduced throughout the 1970s and the 80s. And then in 1990, California had a $15 billion that sound familiar? We have a $16 billion state budget now. But back in 1990, we faced a $15 billion state budget shortfall, which really would have resulted in even more drastic cuts to mental health. So really, the community mental health programs were already sort of near collapse and overwhelmed with need. And this sort of crisis kind of propelled the enactment of Realignment 1991. So this is funded through a dedicated revenue stream and comes directly to counties on a monthly basis. And I think something to note here, there was a really great report published by the Legislative Analyst's Office back in 2001, sort of with an analysis of this, this funding and program. They really concluded that Realignment was, for the most part, successful in establishing a stable funding stream for county mental health. And they also reported that counties had used this funding pretty well and developed more innovative and sort of less costly approaches to providing services. So going on to the next slide here, I mentioned that it was a dedicated funding source. So the two revenue sources that funded it were a half-cent state sales tax and also a state vehicle license fee. So let's see. Next, slide on Medi-Cal now. Mm-hmm. So I wanted to give you maybe just a little bit of history about Medi-Cal in California. The Medi-Cal program originally just consisted of physical health care benefits, and mental health services really only made up a small part of the program. And they were really kind of limited to services provided by psychiatrists, psychologists, hospitals, nursing facilities, and all of this was reimbursed through our fee-for-service Medi-Cal system. So there was no federal funding of the county Short Doyle mental health program until the early 1970s, when it was really kind of recognized that these programs were treating many Medi-Cal beneficiaries. So this Short Doyle started as a pilot project back in 1971, and then counties were able to obtain federal funds to match their own funding to provide certain mental health services. So the next slide here. And the Medi-Cal specialty mental health services really began in January of 1995 when county mental health departments really were taking on responsibility for the authorization and payment of all Medi-Cal covered psychiatric inpatient hospital services for beneficiaries in the county. And a decision was made to carve out specialty mental health services from the rest of Medi-Cal managed care in the mid-1990s. So county mental health departments became the mental health plan in all but 2 counties in California, and then those 2 counties actually chose to partner with another county to be the mental health plan. So California's Medi-Cal mental health program is entirely managed by local government, by our counties. And the next slide, this is what I mentioned earlier about this funding source. This is the largest revenue source for county mental health programs. So now I really wanted to get into Proposition 63, or the Mental Health Services Act, on the next slide. So we passed Proposition 63 back in November of 2004. This was a ballot initiative, as many of you remember, and really provided for the first time in many years increased funding to support California's county mental health programs. And the MHSA really addresses a broad continuum of prevention and early intervention service needs. It includes funding for housing, includes funding for workforce education and training. And the purpose is really to promote the recovery for individuals who are living with a serious mental illness. So next slide here, some additional background. This was the MHSA created a 1% tax on the incomes of folks who made more than $1 million. So this is something the fiscal consultant has told us. This is about 1/10 of 1% of taxpayers in California actually pay this tax. So it's between 20,000 and 30,000 folks who are affected. And these revenues is a really exciting addition to California's public mental health system. It's also really important to note that these funds must be used to expand and not supplant existing services and programs. So, this means, one of the dynamics we've seen happen in the state is that counties still, have to keep up their and struggle with the, declining revenue sources for both Medi-Cal and the 1991 realignment, like I mentioned earlier. And at the same time, building new programs, and I'm sure many of you can attest to this, is sometimes we see service reductions on one hand and service expansion on the other hand with the MHSA revenues. And I really, on the next slide here, I really love this quote from one of our mental health directors, Dr. Marv Southard in Los Angeles County, about how he, sums up the Mental Health Service Act. I'm just going to read it to you. I think it's a really neat quote. He says, the most important change that the MHSA brought forward is to bring the voice of the person receiving services and the families across ethnicity to the center of the conversation rather than at the margins of the conversation. So it's really like the recognition of folks with lived experience as the true experts in the recovery process. So in that next slide here, I wanted to transition just a little bit and talk now about what's happening currently up at the state level with regard to the reorganization of mental health programs and the Mental Health Services Act. And I'm sure many of you have been know about this and have been following it, but one of the largest and really most significant changes is the elimination of both the State Department of Mental Health and the State Department of Alcohol and Drug beginning in the next fiscal year, 12-13, so basically in another month. And then I wanted to just give you a very brief update about where some of the previous functions that were administered by these departments are going. So just to list them off quickly here. So all of the Medi-Cal policy administration now has been moved over to the Department of Healthcare Services. The Office of Multicultural Services, which was at DMH, is now being moved, or the proposal is to move it into a new Office of Health Equity at the State Department of Public Health. All of our licensing and quality improvement programs are moving over to social services. The Early Mental Health Initiative will be going to the Department of Education. The Workforce Education and Training programs, the statewide contracts, those are moving to another state department called the Office of Statewide Health Planning and Development. And the Oversight and Accountability Commission, which was set up under MHSA to provide evaluation, they are also getting some additional training and technical assistance contracts. And then finally, there is going to be a new Department of State Hospitals that is being created. So those are some of the big changes that are happening as a result of this reorganization. So on the next slide here on AB 100, I just kind of wanted to give you an update about how the MHSA funding is changing a bit through the passage of AB 100. So on the next slide, some positives and negatives here. I wanted to start with the positives. So prior to AB 100, many of you know counties had to conduct a stakeholder process and submit local MHSA plans up to both the State Department of Mental Health and the Oversight and Accountability Commission for review and approval. In the cases of the prevention and early intervention plans and the innovation plans, those actually also had to be approved by the Oversight and Accountability Commission. So as a result of AB 100, that no longer exists, and funds, MHSA funds will be continuously appropriated to counties. Now, counties will still need to receive local approval from their boards of supervisors on MHSA programs, and there's still going to be a local stakeholder process required, so that hasn't changed. And they still will have to submit a plan up to the OAC, but none of that review and approval will happen anymore. And then the negative, the governor actually diverted $862 million from MHSA on a one-time basis, but it's not paying it back to fulfill some general fund obligations for, as I mentioned here, EPSDT and the program that was formerly known as AB 3632, but it's now known as Educationally Related Mental Health Programs. And on the next slide, there were some, a few additional changes that AB 100 created, and so listed them here. There was an administrative fund that was reserved for state-level purposes. That was reduced. As I mentioned, DMH and the OAC will no longer approve county plans, although counties will still be required to send in a plan. And counties will still be required to complete what's called an integrated MHSA plan. And again, this will still need to be a local process and local approval of those programs. And then finally, of course, AB 100 removes DMH from the administrator of the Mental Health Services Fund. Now I'm going to talk a little bit about Realignment 2011. So our budget included a major realignment of public safety programs from the state to local governments. And so, with resources and program responsibility at the local level, the notion is that each county board of supervisors can sort of integrate programs that best meet the needs of its local community. So the 2011 realignment is funded through two revenue sources, a sales tax and also vehicle license fee. So the driving force behind all of the realigning of programs was primarily fiscal in nature, but also kind of the idea that local governments with increased flexibility can accomplish, this is the governor's kind of language, can accomplish more with less. And the plan was to create a new dedicated constitutionally protected revenue source for counties. But as we go to the next slide, the plan that was ultimately passed by the legislature did not include support for that. So the governor consequently has filed a ballot initiative with the Secretary of State that includes these constitutional protections for counties and a temporary tax increase as well. So actually he has now just submitted the signatures that you need to have in order to qualify and measure for the ballot. And he's really kind of banking that this will pass by voters in November. If it does not pass, there are going to be some what are called trigger cuts. So huge cuts to education, both at the community college level, also the UC level and the CSU level. He has, cuts to courts, cuts to parks and rec. You name it, there are going to be significant cuts additionally if this measure does not pass in November. So it's not a pretty picture. The governor's May revised budget was just released, as Ann mentioned, on Monday this week. And as I mentioned, the overall budget picture is that California currently has a $16 billion with the B deficit. So next slide here, public safety realignment. The two new programs, just in particular for mental health, that are realigned are EPSDT and mental health Medi-Cal managed care. And mental health is going to be in what is called a behavioral health subaccount, and I'll show you the structure of that in a minute here. And within each subaccount, counties will have some flexibility to meet their local needs. And in the governor's May revised budget, he has sort of the latest figures for the funding for the 2011 realignment, and I can send this table out to Ann to distribute to all of you if you're interested in seeing those latest numbers. You can also pull up his budget online if you'd like to do that as well. And on the next slide here, this is the the funding structure. So again, there's going to be, you can see here under support services account, the behavioral health subaccount. So mental health. So we are in an account along with drug Medi-Cal, drug courts, perinatal drug services, non-drug Medi-Cal services, and then we have the mental health managed care and EPSDP. So it's really interesting. And then the big question that I have on the next slide is, that our the sub-account includes both entitlement and non-entitlement programs. So how the question that hasn't been answered yet is sort of how is this all going to be managed? And we still don't know a lot. We still have a lot of unknowns, and I can go through some of those. But basically, we don't know what sort of the funding is going to look like beyond 1213 in this for the sub-account. We don't know the amount of monthly transfers that are going to be made by the state to each county's account. We don't know if there will be constitutional protections and remedies available to counties for these programs. And then, of course, the impact of our tax revenue volatility on the funding as well. So we have a number of opportunities and challenges in the next slide here. So one of the interesting things to note is that the funding streams for public mental health are volatile and not necessarily tied to need. So, for example, we have our sales tax and our income tax. So typically when taxes are, come in high, the need is low, and when the tax revenue is low, the need is the highest. And so then, and then with realignment, counties have additional flexibility, but some increased responsibility and risk for those programs. So really, this is kind of, in summary here. It's clear that counties, will need to be the leaders with the full engagement of stakeholders in their communities, the development of, behavioral health policy and programs in California moving forward. I've gone through a number of issues today. There's just, there's a couple more dynamics we have on the table. We also have federal health care reform that is being rolled out. We also have federal parity that was passed, and then the elimination of the Department of Mental Health and Alcohol and Drugs. So this has been really a kind of a huge, significant shift. And so that's sort of the conclusion of my presentation. Interested to see if folks have questions or comments about what you're dealing with locally. So are you guys ready? That's my question to you.
Well, so far we have one question. Do you have a slide showing what departments will be overseeing what programs?
Yes, I can. Yes, I do, and I can send that, Shoshana, to you. Just, I don't know how you'd like to get that. Yeah, I do. I have that broken out.
Yeah, if you could send it to me, I can send it out to all of the participants and also post it on the website after the webinar.
Great. I'm going to send to you just the one table in the governor's May revised budget, which has the funding amount for the 2011 realignment, so you folks can see what all of those programs are getting.
That would be great. Thank you.
I have a question for you, Adrienne, that you may not be wanting to answer, but when I heard about all of these changes going on, I guess my overriding concern is, does all this shifting around actually eliminate some bureaucracy or just change it?
It does eliminate some bureaucracy. The funding actually is not necessarily, this is what one of the mental health directors talked about. The funding itself, in terms of the amounts, hasn't changed. It's just that where it's going is changing. So it's all going to counties now to manage.
Okay.
So that it's a good question. I think it kind of remains to be seen. I've
been doing this long enough that I'm a little cynical.
There have been a number of legislative budget hearings over the past few months, and actually a question that's posed by the legislature to departments. And this kind of goes along with all that slide where I talked about where functions that used to be at DNH, where they are going. Across the 6 different other state departments, and the question that's posed is what is the cost savings of this? Right. And there's been really kind of no response to that. So in terms of what's the dollar amount in savings, there's no response. So that was kind of an interesting hearing to watch, and kind of see that. But folks are asking. I mean, oversight groups are asking. The legislature is asking.
And I don't want to take any time from the audience if Shoshana interrupt me if there are other questions from them, but I have a follow-up question. You did mention about the flexibility of the funds going directly to the county, and that sounds like a great thing. You also mentioned in passing an increased risk. One concern that I have, a lot of the people on this call, and including myself, are from small rural counties where there isn't a lot of wiggle room on things. Are they at higher risk?
They're at higher risk. I don't really know how to answer that. I don't think that there's a high, I wouldn't say there's a higher risk in smaller rural counties. Okay. I guess is my response. Okay. It's just, some of the budgets we're dealing with, when you compare it to LA County, it's an accounting error, so right. Right. We just have to be careful with that, I think. Yeah.
There are a few more questions. Well, one is a comment. Joyce Ott says, sub-accounts appear to be drug-heavy and mental health is looking at less medication studies.
Mm-hmm. Yeah, that's true.
Okay. And Joyce also has her hand up, so let me unmute her.
Hi, Joyce.
Joyce?
Hi. Yes, can you hear me?
Yeah.
Oh, great.
There's an echo.
Oh, sorry.
Go ahead.
I just wanted to know where we could focus on less medication and more on recovery in languages when most of the sub-accounts are called drugs something or other.
You want to take that, Adrian? Or I mean, I guess my easy answer, Joyce, is that is a major role of the MHSA funds. I'm not sure how we can influence the more Medi-Cal related funds on that, but it's a good question and one that we've actually discussed in the first webinar on philosophies. But that's going to be an ongoing issue.
Yeah.
Okay, and Sarah Davis wants to know, on a consumer level, do these changes signal a decrease in services such as beds at hospitals and housing? Adrian?
Oh, was that a question? I'm sorry. Can you repeat that? I missed it. I'm sorry.
Sorry. On a consumer level, do these changes signal a decrease in services such as beds at hospitals and housing?
Well, that's another good question. I mean, again, the Mental Health Services Act still, it still exists. It's just that counties will be receiving the funds directly instead of having to get approval for programs up at the state level. So the philosophy, the statute hasn't changed. The philosophy hasn't changed in terms of, the focus really on prevention and recovery and less costly interventions. This new Department of State Hospitals that's going to be created, where people are still kind of looking to see what that's going to look like and how the state hospitals in California will be managed under this new department.
Any other questions?
No, that's all so far.
Okay, I want to just summarize a little bit. This is a massive amount of information, and as Adrian pointed out, it's a little in flux. There's a lot of unknowns. And as I said, Adrian was up putting final touches on this on Monday after the governor released his bill. I think this last question she posed, are you ready, is a very important one. We need to not only be continuously aware of this, but we've talked throughout these webinars of the importance of advocacy. Be involved in this next election when, you know, some very, very important issues are going to be on the ballot. Do talk to your neighbors and your friends and your colleagues about what this funding things will actually mean in our communities. And the more we stay involved in that, the more we can hope that the policies are going to go in the directions that we need. So I want to thank Adrian. It was a fabulous presentation and gave us a lot to think about, and I do understand things are in flux, but I really do appreciate you taking the time. Adrian, I think you have to run off to your conference. Are you going to stay on?
Yes, I just wanted to say folks have my contact information on the first slide, my email. So if you think of follow-up questions, please go ahead and email me, and I'd be happy to do a follow-up presentation in the future to this group.
Great.
And if there are other specific, more specific questions that I could hit on in another presentation, I'd be happy to do that. I wasn't sure how much background folks had on this, the folks on this call. So sorry if it was repetitive or if it was too much information, but I'd be happy to do a follow-up in the future.
Fabulous, Adrian. I think this was really helpful. Thank you.
Thank you. Bye, everyone.
Bye.
Bye, Adrian.
Bye.
Okay. Wow. That was great. I'm going to switch gears here now and do the second part of the presentation where I want to talk about what we call supplemental funding. As Adrian pointed out, the vast majority of funding for mental health comes from the government in various forms. However, this idea of supplemental funding, most organizations that are able to thrive and even expand can do so because they develop what is known as multiple funding streams. In other words, even in tough economic times, if you have these multiple funding streams, you can juggle your accounts a little bit. If one funding source goes away or is decreased, you have another source to get you through the tough times. Rarely, if ever, is it a good idea to depend on this kind of supplemental funding for your day-to-day running of a program. However, if you do have these supplemental sources to run your wellness centers, you can create a truly robust and diversified program and do the kind of expansion we all know needs to be done. Excuse me, I have allergies and the pollen count is extremely high today. Most supplemental funding is based on developing a fundraising plan within a nonprofit organization. And these first two items, donations and fundraising, refer specifically to that. I do realize that not all of you do belong to a nonprofit. I'm going to give you some information to think about on whether or not it is a good idea for you to create a nonprofit if you are not already in one. I don't have the time to actually, or the expertise really, to actually help you create it. But I do know the right questions, and in the next slide I'll be introducing some of the requirements and benefits of having nonprofit status. And then we will also talk about this last topic of grants that you are eligible to get whether you have nonprofit status or not. Just in terms of how I broke this down, I think it's pretty self-explanatory. But I did want to point out something that most people don't seem to realize is that nationwide in nonprofit corporations, by far the largest funding comes from individuals. And so finding ways to do that through annual funds or events or whatever, direct solicitation, that makes up about 75% of most nonprofit budgets. We hear a lot about the corporate donors, the business donors, and they're not to be overlooked. I think that for very specific projects, going to a business or a corporation to sponsor that will help you get a larger pile of money at once, but usually for a very specific project, not an ongoing general fund. So I'm going to move on to the next slide here and talk a little bit about nonprofit organizations. Many of you who work for nonprofits or involved with nonprofits actually have a large, well-established umbrella organization helping you fund this. For example, in the second webinar, we had presentations from the Wellness and Advocacy Center in Sonoma County. That is affiliated with Goodwill Industries. Also on the panel was Second Home from Shasta County, Redding, which is affiliated with Northern Valley Catholic Charities. If this is similar to your situation, chances are a lot of the details on this slide are handled by your umbrella organization, and you may not even realize the day-to-day things that go into that. However, I do know that some wellness centers are looking into the possibilities of being a freestanding nonprofit, so I thought it would be helpful to talk about what that entails. First, I have a question for you. I'm curious, is there anyone in the audience now who works for a freestanding nonprofit? In other words, the nonprofit is the wellness center. No, huh? Okay, that's what I thought. I think this is a big deal to do this, but I do want to go through it because I know that some people are thinking about it, whether this is a good idea or not. So, in terms of the requirements, if you ever want to consider, well, actually, let me back up a minute. Before I go into the details of this slide, I want to make two other points. Excuse me. First, throughout all of these webinars, we've emphasized that we value the process or the journey, not just the outcome. So I think whether or not you ever develop a nonprofit organization, going through this thinking process to make the determination if nonprofit status is right for you is a healthy procedure and will strengthen your organization. Which leads me to my second point. Part of today's topic is about sustainability. Most people simply think of sustainability as meaning sufficient money. And we all know money is important. But sustainability is also dependent on leadership, vision, focus, and energy. And I think the concepts on this slide will help you with that. So therefore, strengthening your organization, even going through the process, regardless of the outcome. Okay, back to requirements. The first three listed here are really all go together. It is your board's responsibility to develop bylaws and policies, as well as vision and mission statements. This creates the blueprint for any type of funding that you go after. Oh, excuse me, I'm so sorry. Notice that I emphasize talent on the board. This is especially important if you want to be a nonprofit agency, as you will need input, preferably not paid for, from people with specific expertise. If the expertise that you need doesn't exist within your member or consumer organization, you might want to consider recruiting some people from the community, from the outside to help you. This becomes a touchy subject because I think ideally most people are striving for completely consumer-driven organizations, but you have to decide what you want for that organization. Therefore, these three things go together. Based on your vision and mission statements, you may need to change the makeup of your board. And that is done through a revision of your bylaws and board policies. Let's see. Again, I realize this is a touchy subject, and I'm not telling people what to do one way or another. It really depends on where you want to go with your organization, and you have to do a good examination of what skills and abilities you have to decide if you need people from the outside. I would say the one piece of advice I would give is that if you are going to change your bylaws to allow for more diverse board membership, I would keep it as a minimal requirement that at least 50% of the voting board is members of the Wellness Center or consumers, to keep that voice strong. Some people list it as 2/3. Some people say, no, I don't want to go this way. It all has to be member-based. And that's fine. And maybe within your particular group, you do have enough diversified skills that you can get some things done. That's a decision that your boards have to make. Okay. The rest of this, after these three, compliance, certification, these are kind of the nuts and bolts of what you have to do if you do decide to create a nonprofit. Again, if you want to go this route, you definitely need to recruit experts to help you with this, whether they're on your board or not. So then you need to ask yourself, is all this worth it? Maybe, maybe not. I've listed the primary benefits of the nonprofit status, which largely has to do with how you raise your money. But depending on your organization and locale, excuse me again. I'm so sorry. Try to make a realistic appraisal of how much money over the long term you can actually expect to see.
Need some water,
while I try and catch my breath, let me answer some questions.
So far, there aren't any.
Okay.
Okay, though?
No questions?
No.
I'm taking some water, so I hope they won't cough anymore. Sorry. Okay. Let's move on to talk about grants. A lot of people talk about grants. You hear things all the time about there's tons of money out there. Well, there is money available for grants, even in these rough economic times. But that doesn't necessarily mean you're eligible for them. So, and I want you to keep in mind that regardless of where your money comes from, government or nonprofit, I highly recommend that you institute a formal grant application procedure in your centers. Once you have the template to do that, you can apply for many grants relatively easily. It doesn't mean there isn't some risk and work up front, but the idea is you don't just apply for one grant. You develop a whole program so that when grant opportunities come up, you can crank them out pretty fast. There's an unspoken rule in administrative circles that grants less than $30,000 are not worth the effort. However, I think there are two situations where you should ignore that advice. First, in rural areas with low populations, $25,000 can actually go a long way. And second, these smaller grants help develop a track record to apply for larger grants. So if you have a long-term plan, I think it's worth the energy to go for the smaller grants, which leads me to my first point here. Everyone says that the first step in getting successful in getting a grant is to have a history of prior grants and successful outcomes. Well, that feels a little bit like a catch-22, and usually this is the thing that stops people in their tracks and discourages them, that you have to have had a grant in order to get a grant. But the way to do this is to start small with a track record. Go for some of the smaller community grants. In almost every county there is a small community fund, some kind of foundation. Here in the North State we have the tribal councils who have money from the casinos. They are required by law to have a community fund. That's a good source. If you start with some of these smaller grants, you establish a track record. The other way to do it is get yourself written in collaboratively on a much larger grant. UC Davis or someone like that who has a huge research facility often likes to partnership with small counties, small organizations, things like that. You don't necessarily have to do all the work, but you get yourself written in and then you become part of that grant. That helps you establish the kind of history you need to go for the large grants. Probably most important in my book is that even before you ever get to writing a grant, you need to set up a system of documenting outcomes, and I'm going to actually talk about that in the next slide. But you have to have your record keeping in order. And you document outcomes whether or not anyone asks you for them. You have your data ready. Okay, the next couple items on this slide are there as reminders as you develop grant ideas. Do you have the right people, the right place, the right support? Can you evaluate your results? Again, even if you aren't initially successful getting grants, going through this process will strengthen your organization and ultimately help you create the path to success. You need to be reflective. What can I do better? What does the organization need to do? Those kinds of things. I also want to add an item that I didn't write down because, frankly, it sounds a little insulting. My best advice to people who are applying for grants is to follow the directions. That sounds like a no-brainer, but you would be amazed how many people don't do that. I review a lot of documents, grant applications, dissertations, manuscripts submitted for publications, and I can tell you that not following the directions, no matter how silly you think those directions are, is the #1 reason for grant applications getting rejected. If the submission does not follow the exact format requested with the exact components requested, very often it doesn't even get read. So you can have the most wonderful idea in the world, but if you decide to do things differently than the instructions, no one will ever hear it. So these are the kinds of things that you have to pay really good attention to, the little details. Questions? Oh, come on, someone must have a question. Grants are a big deal. Comment? Nobody? Can I get some feedback? Is there anyone who has had some success in a grant?
There is someone, James has his hand raised, so let me unmute him. James, unmute.
Good morning. Yes. Hi, Ann. I just have a quick question about the wellness centers that we have existing in our county services, and why should we go out? I know there's a huge push to go out and start independent wellness centers, but seeing how we have the funding sources within our Mental Health Services Act, I would really like to see more of wellness center supports being given to us, and which would not give us the inclination that we need to go out and, or some of us, I know we have to do what's best and follow our own conscience, but I would just like to get some clearer directives from CIMH in terms of studies and wellness center stuff, so we can do a better job working with our wellness centers within our counties. Does that make sense?
Yes, I think there's a couple of points you're bringing up. I personally am not suggesting anyone to go and try to be completely self-supported. My point is that multiple funding streams allow you to have the most diverse, robust program. So what I'm talking about is supplementing the MHSA funds, not replacing them.
Okay.
In terms of developing a data bank, I completely agree with you. I think it has to happen on both levels. There has to be some money from the state to allow for research and documenting outcomes. But I also think, and I'm actually going to talk about this in the next slide, there are ways that we can do that ourselves, even within small local places without a strong history of research or anything like that, or without training in that. There are some simple ways to do that, and the more we do that ourselves, the more we are going to be situated when further funding is available to be ready for it. So I think it has to happen on multiple levels.
And are there other county behavioral health run wellness centers that have went out and applied for grants and are receiving certain monies from different grants that are going directly into the county wellness center? Is that happening? Because I'm not in touch with other wellness centers that much to know.
Right. You know, to be honest, I'm not sure. We have certainly talked about it within our wellness center. Last year I got a small grant from the Tribal Council for Jobs Program Development. There are ways to do that. I think, frankly, we probably are starting at the beginning, which is why I broke this down in, you know, ways that, where do you start? I do think it's something we need to do more of, and we need to talk to each other. I was going to save this for the end, but I'll say it now. I did mention in an earlier webinar that I wanted to develop a list of contacts and from the different wellness centers throughout the state, so we could share and talk to each other some more. There may be ways across several counties to apply for grants together. I did not do that yet. I was unrealistic planning my time. That was silly of me. There was no way in May as an educator I could do that. But I am going to follow up on doing that. So I do think networking with each other is an important next step, and one of my goals for the next year is to help that process along.
Thank you. That certainly makes a lot of sense, and please keep us informed as that process develops. I don't think there's ever anything. I'm from Butte County,
oh, okay.
And yeah, work up
Great.
at Paradise. We have a wellness center up here. So,
Fabulous.
but I don't think it would ever hurt to try to get written into certain grants and see how that funding source could
yes.
filter into our
Considering where
wellness centers.
you are, a good source for you would be Chico State. They have research money, believe it or not. As dire as the CSU situation is, and I'm still on the payroll at CSU, I can tell you it's pretty nasty. But it's also that same thing that happens in the universities that Adrian described, is that sometimes money is dedicated and can only be used for one purpose. So as dire as the CSU schedule budget is, it doesn't mean that there isn't some money set aside for collaborative research. So it's about making those connections.
Thank you so much.
Thank you.
All right.
Any other comments or questions about grants?
Yes, Sarah Davis wants to know
Sarah?
how does one begin in grant writing?
Well, these tips that I have here are the start. I think part of it is, and I'll talk about this a little bit more later on, is getting very familiar with the databases. If you're talking about the big grants, you go to grants.gov. It's literally the clearinghouse for all federal grants. And you can type in keywords and find out, what's available. However, I really think before you even get there, the first step, as I was alluding to in the previous dialogue, is make connections. Know what resources are in your community. Take advantage of the expertise that's right in your neighborhood. Get to know your local foundations. The smaller private foundations are often a really good way to start. Find out who's a nonprofit in your county. You can Google this and find out. And go make the contacts and talk to them. That's the first step.
Okay. Rosemarie Wilson says, wellness centers, can they be expanded? Not sure exactly what that means. Do you understand that?
I think they can be expanded given the funds. And of course, given the resources. There's no point expanding if you don't have the people available to run programs well. So that has a lot to do with who you can employ, who's available to employ, what kind of space you have. Those are all decisions that go back to that. I'm going to go back to this slide. In terms of nonprofit, but this applies whether you're a nonprofit or not, what your bylaws are and what your vision and mission statement is decides that. If you decide that expansion is one of your goals, then you have to make sure that you have the resources to do that. For some people, that's not a realistic goal right now. It's basically you're doing all you can to keep body and soul together and maintain. That's okay. These are all very individual, but it is really up to the board of the Wellness Center to make those decisions. Hopefully that helps. Again, I want to say one more thing about grants is that keep in mind grants are rarely a good way to go about for the basic day-to-day function of the organization, and it is not a good idea to depend on them. One of the problems with grant-driven organizations is that they're always time limited. So you may have a grant to do this fabulous program and in 2 years the money runs out. I always think that's a little sad. You start this wonderful thing and then it falls apart. So you need to have a long-term plan on how any programs you develop can be sustained. Lots of times the grants are for startup money. They may get you the equipment, or they may, get you the supplies, or buy a little time for your staff to do something. But you need to have a long-term plan as well.
And Joyce Ott wants to know, what is the cost to file a grant?
None. Other than your blood, sweat, and tears, which again, when I made that comment earlier that a lot of administrators in health administrators won't even go for a grant for less than $30,000. It's because of the time intensiveness of putting this together. Sometimes it's just not worth it. But again, at least starting out, I think sometimes you put in the time and eventually it'll pay off. But unless you're hiring an outside grant writer, which some people decide to do, there is no real expense other than time. And I'll just say a word about this idea of hiring a grant writer. There are people that are really very, very skilled at this. And what I know some organizations do is they collaborate. It's, a large amount of organizations may pool together to hire one grant writer. Sometimes counties, in the county supervisor's office, they may have someone who will do this for you. So you look around for the people who have the skills in putting these things together. There are even cases, I wouldn't know how to find them off the top of my head, but there are even cases I know of people who do grant writing freelance that will basically help you write your grant without pay. But what they do is they write in kind of their own pay on an administrative support line. But they only, in other words, they only get paid if they're successful. If the grant isn't successful, you don't have to pay them. So that's another thing to be thinking about. Any other questions? No? Okay. The bottom line for all of this that I've alluded to several times already is that the place to start is start documenting your outcomes right now. Don't wait. This is going to help you with the process, the sustainability of your organization, keeping it focused, keeping it moving forward, and the nice little side benefit is you may get some more money from it. But I think the thing to keep in mind, I'll go to my last slide here, is that people do have a right to know where their money's going. So before you even are asked for it, you want to have this data available to you. So in this era of accountability, someone's going to challenge you to explain why they should keep giving you money, whether it's a government source or a private source. Why should they keep funding you if they don't see any evidence that it's making any difference? So you need to be proactive on how to do that. And as I said, that data collection then becomes the basis for your track record for grants and donations. One of the standard ways people are doing this these days is doing what's called logic models. Logic model, I can't teach you how to do this. It would take a few days. But I'm going to place a booklet on the CIMH website. If you want it right away, I'll email it to you. It's about a 70-page booklet. It was put together by the Kellogg Foundation, which is one of the larger philanthropic private foundations. And yes, that does have to do with Kellogg cereal. It's in Battle Creek, Michigan. But they have been doing this for a very long time. It's a corporation that is run one of the more well-organized, I think, of the private foundations. They put together this booklet on how to do logic models and why they're helpful. And there's lots of exercises and lots of examples. I would encourage you to look at this booklet and try one out in your board of directors to help you. What they do, all it is, it's not really that hard. It makes it look, bigger than it is. All it is drawing a picture, a nice little diagram, a visual representation where you spell out what your goals are, what your outcomes are, how you're doing this, what are the principles behind this, and how do they all tie together. It's your planned work, your resources, your activities, as well as what your intended results are. What do you want for outcomes? How is this going to impact the community? And it comes out in this nice little diagram, one-page picture. It's a very interesting process to go through this. You can learn a lot about one of the reasons that everyone is encouraging using logic models is that it's a very easy way to see what's missing. It will help you grow as an organization because you say, oh, we don't have anything to put in that little box here under activities or resources. We need to think about that. What else do we need? You can learn about, it's a reflective process where you can learn about your organization. I also put this in here because if you are considering going for grants, a little word of warning. I have been amazed at the number of grants that I have looked at lately that are now requiring an attachment of a logic model. So if you read one of these grants and you never heard this term before, it'll freak you out. It did the first time I saw it. What are they talking about? But if you're used to this process and thinking like this, you're going to be way ahead of yourself in your ability to get grants. Basically, when you have this, one-page picture, it will sell your idea for you, which for people who struggle with the writing part on these grants, and particularly if you're a visual learner, this is really an effective way to go. I'm going to tell you something as kind of from an insider perspective. As I told you before, I review a whole lot of different kinds of proposals, including grants. And I love these things. A lot of the reviewers love logic models because on a one-page picture, I can tell whether someone is capable of doing this grant or not. If they have the resources, if they know what they're talking about, if this makes sense and is really going to make a positive impact on their community. One of the problems, and the comment I made earlier about how important it is to follow the directions, is that reviewers get in a really bad mood when they're looking for the answer to something and they have to wade through a bunch of verbiage and finally find it on a paragraph on page 14. That doesn't help you sell your program. That doesn't help you sell your proposal. So from a reviewer's point of view, and always try and think of it from that other person's point of view, this is a very quick, easy way of looking at what it is you're actually talking about. And as I said, I think the process itself is really wonderful. Before I go on to other outcome reporting, are there any questions about the logic models? Has anyone ever heard of them before or used them before?
Joyce says yes.
You've used them. Well, Joyce, for those of you who don't know Joyce Ott, she's on like a zillion committees around California, so I'm sure you have. Anyone else use them or find them helpful or not? Okay, I would like, as I said, I would like you to try these out in your organizations. Look at the Kellogg Foundation booklet that we will be putting on the website, or I can email it to you if you're interested. Try out some of these exercises in there, and I'd love some feedback, even months down the road about what worked and what didn't, because I think they're helpful, but I would really like to hear from more people about them. And as I said, if you are planning on doing any kind of proposals or grant work, a lot of places are requiring them now, so you do need to get comfortable with them. Okay? Any other questions? Okay. If that process of the logic model seems a little overwhelming to you at the time, I still am going to strongly encourage you to find a way to document what you are actually doing within your wellness centers. And I'm providing another form that I developed on outcome reporting. It's very simple. It's very straightforward. It's even easier than a logic model. I specifically designed it for low population areas. And a little history of it. I designed it initially when I was consulting on helping out the people in our county who had PE&I grants. These are the prevention and early intervention grants, on how to do the reporting for those grants. And I came up with a system to make it easy and to make it uniform. One of the things that happens with all these different projects we're starting and new programs we're starting is that they're kind of apples and oranges and they all look different. So I tried to come up with one simple format that regardless of what it is you're doing, you could use a form like this. And I'm going to go out of this for a minute and actually show you the form. If I can find it on my desktop here. There we go. Okay. So regardless of whatever program or project you're doing, even ongoing, even if you're just talking about the drop-in services at your wellness center, that's fine. But I think it works better if you're really trying to collect data on very specific projects. You know, for example, you may have a small work group, or you may have a volunteer group, or you may have a recovery group ongoing, or whatever you have. But what you want to do is keep a record of who the audience is. Actually, I'm going to go to the second part because I actually give instructions for this. So, narrow it down. What project are you talking about? I say 100 characters or less because that is usually what's required if you're going to publish anything. So it's just a good idea to keep it brief, keep it concise, but keep it very descriptive. What are you talking about? What is it that you're collecting data on? Very brief description of what it is, who's the target audience, and what's the setting. Number of participants served. You want to be able to keep records on either a daily or a weekly basis. But in terms of data collection, be sure to differentiate between individuals and contacts. You know, for example, you may see the total number of different participants may be 24, but you had an average of 3 contacts with them. So that makes the contact number 72. Particularly when we're talking about small counties, I hear this all the time. People say, well, it just sounds so ridiculous if I'm talking, you know, about 5 people. It's like, okay, but if you saw them every day for 3 months, you're talking hundreds of contacts. So one of the things you need to learn in reporting is how to present your data in a way that really shows the impact. Okay, make sure you have clear goals and objectives. Sometimes the goals are very broad, but they're not measurable. You need to tie those to some very specific objectives that are observable and measurable. You should periodically be doing narratives, just summaries of what those outcomes are. But again, for those of you in low population rural areas, overall numbers rarely tell a story. You know, I think we've been indoctrinated to think that we need these massive amount of numbers to show effectiveness, and it isn't really true. You can highlight percentages. For example, reporting that 12 clients were seen over 3 months is not an outcome, and nobody's going to care. But if 10 of those 12 clients were retained in the program, the percentage is 83%. And that's impressive. If you package this in a way, it's not lying, it's not cheating. I know the old Mark Twain thing about, you know, 3 kinds of lies and statistics being one of them. It's a way to present yourself, one, in the most positive light, but I think more importantly, that truly captures what it is you're doing within the context of where you live. Reporting trends is also important. For example, if a program started with 6 participants, but you had great referrals and great community support and you ended up serving 24, that's a huge increase statistically. So, you know, take a look at things like trends, take a look at things of overall percentages, positive changes, things like that, which really helps. In terms of the kind of evidence of outcomes, again, this particular outline that I'm showing you is geared towards rural counties where we are not going to have these massive amounts of numbers. 2 examples that I recommend people use are a case study and a survey. There are other tools, but you know, these are the 2 tools that I think fit best in rural areas. So a case study is just basically a short narrative of one person's experience. You interview the person along with your own observations. If you're working with minors, you may want to interview others as well, their families, the teachers. Direct quotes from participants are very powerful. And you emphasize the positive changes. The example I give here is a participant may have started the program with behavioral issues or lack of social involvement and ended up participating in leadership training. You're showing a trajectory. You're showing a positive change. Now, some people, particularly people in fields like mine who are well trained in research, used to dismiss these kind of things, saying, "Oh, they're just anecdotal." It's not true anymore. Even on a federal level, they're getting it that these personal experiences, these lived experiences, these personal stories are very, very powerful. And again, particularly in a rural area where you're dealing with very small numbers, you will never be able to compete with LA County in showing an increase of 700 people per year. It's not going to happen. So finding these other ways of demonstrating, yes, we are making a difference, yes, we are being effective, is going to help you develop that background, as I said, to move on for other programs, for other funding, etc. And the other way to do it is a simple survey. You determine at predetermined intervals when you're going to administer this. And even if you have an ongoing program that's been around for a long time and you plan on having it a long time, set it up to collect some data at regular intervals, maybe 3 months. It's best if you have surveys that have both quantitative and qualitative data. And I don't know if you know what Likert scales are. You probably do, even though if you don't know the term. It's like on a scale of 1 to 10, 1 being nothing and 10 being the world. And you have people come up with a number. The example I give is a project focused on community socialization. You may ask, on a scale of 1 to 10, how involved are you in community activities prior to this program? Using the same scale, how involved are you in community activities now? These scales can be used to measure general perception of satisfaction and performance. Again, I think in a very traditional research sense, people didn't used to care about this. They would just want to see other kinds of measurable outcomes. But researchers on all levels, including the funding sources, have now gotten it that perceptions do matter. I'll give you an example. Kaiser healthcare system, one of the largest in the country, and certainly in California, does routine patient satisfaction surveys. This isn't using data of from the medical model. This isn't using data about how much illness decreased. It's how satisfied were you with your services. Even an organization like Kaiser gets it that people's perceptions are incredibly important. So if people perceive, if people feel that they are benefiting from something, they are benefiting from something. And this is the kind of data that is now quite acceptable and can be used even in very small counties. In terms of the qualitative data, and what I mean quantitative being number-based and qualitative being word-based, it's always best to ask some open-ended questions, but also help people structure it by asking for very concrete, specific answers, like examples. So here's a couple of examples. Share a story of how this program has helped you in the community or with your family and peers, or what was the most important thing you learned about yourself as a result of this program. These are very, very easy ways to have a system set up where you can routinely be collecting outcomes. And again, I urge you not to wait until someone asks you for the data. Have it ready. This applies obviously to big funding sources. As I said, the government can at any time come in and do audits, and when you have this stuff ready to go, you're going to be in much better shape. It also applies to even individual donors. Say you want to do an annual fund, that you have nonprofit status and you want to do an annual fund. You're going to get a lot more support if you can tell people, look at what we've already done. We can do this. We have the skills. We have the abilities. We've already done this great stuff. Help us continue that. Help us grow that. People are much more likely to want to help you out. Any questions on that? How many of you, is there anyone there who has a system for collecting data now that you like?
We have a couple of people who would like to receive the outcome materials, have them forwarded. James says,
Okay.
I believe
the best way to do that. Sorry, Trustee. Go ahead.
But both Maria Los is asking and James also is asking, and he says, I believe wellness centers should be following up on being able to provide this data regardless of our individual grants.
Yeah, I agree. In terms of getting any of the resources, they will eventually be posted on the CIMH website. If you don't want to wait for that, on the last slide, I have my email. Right after this is over, just send me an email on exactly what you want, and I have all of this material in PDF files. So I will gladly pass it on to you. Just send me a quick email, because if I try and write notes now, I'll lose them. So feel free to do that. Any other questions on logic models or outcome reporting?
Joyce says, I hate mine, now need a new one. Outcomes are the hardest to document. That is what is needed for training. Yeah.
Joyce, you bring up a good point, and as usual, someone comes up with the thing that gets me to my last slide, second to the last slide. Get help. I know and completely support and understand that people want to be autonomous, but rarely is there an organization, whether it's peer-based or not, that has all the diversified skills that's needed to do this. So I think the first thing is to either develop yourself or find someone who will help you develop the computer proficiency so you get familiar with government and foundation databases and websites. What is the literature saying out there? What can you learn? We are in an era of, frankly, information overload, but the good news about that is that there's tremendous resources available to help us learn how to do these things. So that's my first piece of advice. But also, as I alluded to before, I think that a lot of organizations need to recruit very specific expertise. Whether you want them on your board or not, it is a debate, and a debate that needs to happen within your board, and everyone's situation is different. But also make connections, even if you have to pay people. But you would be surprised how many people in your communities are willing to volunteer some time to help you, as long as you ask the right questions and ask for very specific feedback. Lawyers, accountants, business people, researchers, grant writers, teachers. These are all people that have a piece of the puzzle. Lawyers may be able to help you incorporate documents for nonprofit status. Accountants can help you set up how to manage your budget. Researchers can help you with how to develop outcomes, as Joyce said, how to develop a database of how to do this yourselves. I would put it in terms of recruiting for very special projects. I need someone to help me with this particular task. I know that even in a small town like Weaverville, which is where I am, there are people that if you go to them and say, I've had dealings with our local Chamber of Commerce, our local business association, the Rotary Club, which tend to be all business people. If you ask them, can you help us with this, one particular thing? It's generally not a very time-intensive thing. And I think that we do need to collaborate within our own community resources much, much better. And Joyce, I'm the go-to person that you want to help you develop your outcomes. You can just call me. Any other questions or comments? No? Did this overwhelm you a little bit? I think between Adrian and I, we put out a lot of challenges to you on what you need to do to either expand, maintain, or sustain wellness organizations, wellness centers. It can be a little scary. But as I said, I do really believe that there are people there available to help you if you think through what are the questions, what are the labs, what is it your particular organization needs. No comments? Not scary? Did I make that up? All right. We have about 10 minutes, which is just perfect for my very last slide here. As you know, this is the last webinar in this series. And as I said, the resources are available through me. You'll notice at the bottom here, you can contact Shoshana, you can contact Adrian, or you can contact me directly through these emails. Anything that we can do for you to help you with this information. I realize you got a big dose of information today. Please feel free to contact me. I also mentioned before that I do, one of my goals is to develop better contacts and networking between the various wellness centers throughout the state. Some of you have very graciously invited me to visit your centers, and I want to let you know I'm going to follow up on that. I do plan on doing a California road trip later on in the summer. So if you would like me to come to your particular wellness center, and I would love to visit and see these places, but also I'd be willing to meet with your staff, please send me an email, and I'll see if I can fit it into my itinerary. I would really love to do that. As Shoshana mentioned, we are hoping to be able to offer another series of webinars next year. We don't have the details hammered out on that, but Shoshana and I both wanted to end this with getting some feedback on what kind of topics should be presented. I listed the 4 webinars we did: recovery perspectives, wellness centers, employment, and sustainability and funding streams. Each one of these topics could be repeated just as is, have different people involved, or with updates. They are all moving targets and they all change pretty constantly. I would like some feedback from you on which of these should be repeated with updates, or what new topics should be presented in webinars. Please give us your feedback. It will help in the planning a lot. Shoshana, anybody? Hello?
No one in response to that question. Just Joyce says, people can vacation and visit Weaverville Center. You'll love it.
Yes.
And now Sarah Davis has suggested one that would be of personal interest is the family role in supporting consumer mental health.
Oh, really good idea. Shoshana, are you taking notes?
Yeah.
Okay. I agree. I think the family role is an interesting one, and one that is changing. For those of you who are involved with NAMI, that has largely been a family initiative. Sometimes there's a little tension between the consumer organizations and the family organizations. It's clearly something that is not helpful. And how do we do this in helping recovery? I think would be a great topic to explore. One of the ones I mentioned earlier in another webinar that seems to come up a lot is, what do you think about the idea on doing a webinar specifically on stigma reduction programs or initiatives? No comments?
Sarah says, yes, that would be of interest to me.
Okay. Thank you, Sarah, for always pitching in. It makes me feel like I'm talking to somebody. Come on, somebody else out there. What was helpful, what wasn't?
There is, oh, never mind. Go ahead. Also, another topic advocacy for those with mental health issues,
Yeah.
mental health illness. As my brother's advocate, oftentimes I feel like I am shooting blindly.
Okay. Well, there's a couple of different issues there. We could have one just on what is advocacy, because it covers a lot of different topics. One, Sarah, I think you are alluding to is how does someone else advocate for the person with mental illness? That's important, but also what a lot of the recovery literature and programs are dealing with is more from the perspective of self-determination. How do you help people advocate for themselves? And I think actually both of those things need to be addressed.
And Joyce says self-reliance and peer support is important to empower clients and family.
Yes. Self-reliance is the other term that's used a lot with self-determination. I agree that that in and of itself is a topic. But I also like the point you're getting at about support, Joyce. To me, that also kind of goes with the stigma reduction. But I like to put it in terms of what I call social inclusion. How do people with mental illness become a full member of a community? Very often they are marginalized, and addressing it that social inclusion is all about health and wellness. In fact, it's one of the dimensions of wellness as defined by SAMHSA, is being a member of a community and being included. I think it's very important. Any other ideas? Okay. I would like to conclude by thanking Shoshana Zatz and the California Institute of Mental Health for the opportunity to present these webinars and all the support that they've given me doing this. And I've learned a lot through the whole process, and I hope you have too. It's been a pleasure, and I thank you all very much. Shoshana, let's sign off.
Thanks, everyone, for your participation.
Thank you.
Bye.
Bye.